What's going on, guys, and welcome back to another episode of the world's okayest physical therapist. I really appreciate you guys being here. Thank you so much for tuning in and listening. I'm your host, Dr. Andrew Hinton, physical therapist. And today we're taking a look at the difference between an athletic trainer and a physical therapist, an AT versus a PT. So, just like last time I was talking about the difference between a physical therapist and a personal trainer, today I'm tackling the next most commonly asked thing of, hey, you're a physical therapist. Are you kind of like an athletic trainer? Uh, and that's what we're going to break down. So, let's dive right into the differences in the roles. Now, an athletic trainer is going to be someone who follows a team around, right? Athletic trainers, like the name suggests, is interested in training you to do athletic performance. And that's why high schools have them, colleges have them, sports teams have them. And they are usually the first one onto the court, onto the field, onto the pitch, if you're British or European and you're playing soccer, onto the ice rink, whatever, that is going to be evaluating someone that likely has an injury. Whenever you see someone take a bad hit and they take the golf cart out and they put them on that stretcher and they have that guy out there assessing them with the little flashlight, taking a look to see if they have a concussion or anything, that's an athletic trainer most of the time. A physical therapist, by comparison, is going to be sitting in their office, hanging out, waiting for a patient to come in, and they're going to assess them in the setting of their office, and they're going to do a very in-depth, joint by joint assessment, comparing left to right. It's much more of a slow, methodical, how is your body moving versus an athletic trainer of, okay, this guy looks like he just ruptured every tendon in his ankle. I need to test every tendon in his ankle. Yep, it looks like he ruptured every tendon in his ankle. How can I stabilize the ankle and get him onto the cart to get him to going into getting an MRI or whatever we need to do? So if you want to think about it that way, an athletic trainer is very much like a first responder in that sense. They're the first one responding to the crisis. The physical therapist is an order or two, so order of magnitude one or two removed from that, where we're waiting in our office and we usually get the results of the imaging and what the athletic trainer said, and then we know what we want to do for that patient. So, kind of in summary, ATs, athletic trainers, are going there to trying to do acute care on the field. They're trying to do a response, and they're trying to also figure out with their athletes, hey, are these guys good to play, or are they borderline good to play, or how long do I recommend that they play? Right? Can they play an entire soccer half? Probably not. Okay, well, what if we introduce him towards the end, the last 15 minutes of the second half? We get him on the field, get him used to running around again because he's been off the field for 9 months because he had an ACL tear, right? That's where athletic trainers will be making a little bit of those decisions and putting their input in. A physical therapist who's been working with that patient to rehab them, to get that range of motion back, to get that strength back for that quad, will also have a saying of when they think that they should get back onto the field and when they should be playing and how they should be playing. But as I'll give you an example here in a minute, the physical therapist is really more focused on, can I just get you stronger? Can I improve your range of motion? Can I do my special tests to show that your left quad or your right quad is as strong, 90% as strong as your left? Because that's the sort of criteria that physical therapists use in order to determine, for example, not in every case, but in this example, that could be one that is driving the judgment of the physical therapist of, hey, your quad is 95% as strong as the other one. It's been months. Your ACL reconstruction went well. I'm not seeing any range of motion limitations. I'm not seeing any hesitancy. I'm clearing you to go back to practice and to start practicing with your team. And then the athletic trainer picks up and goes, okay, you're back on the field. You're back playing. How am I going to dose you? And how can I train you to get back to playing on the field and scoring goals? But we'll touch on a real life example of that in a second. Education. Education's a big component, right? So physical therapists, like we talked about last time, are in school for 3 years or more, a little bit over 3 years, and it's a doctorate program, right? So usually you if the physical therapist really, really, really wants to flex on you a little bit, they can say, actually, it's doctor. But I almost never use doctor in front of my name unless I'm writing an email or requesting something from someone, and they're kind of ignoring me when I say, hey, it's Andrew, and Andrew is calling once again because I would like to have this information on this. And they go, yes, there's a long call wait for patients. You just have to wait in line, and you're number 80 in the call. Versus when you call and say, "Hi, this is Dr. Andrew Hinton calling about yada yada yada." Everybody goes, "Oh, whoa, it's a doctor. Okay, how can I help you?" I hate to say that's the case. My background in the Army, I was enlisted, I was a sergeant. The amount of times when you flex and say, "Yes, I'm here on behalf of this officer, this lieutenant colonel, this major, this full bird colonel," and you get things done versus when you say, "Hey, it's Sergeant Hinton, I'm calling about this," and you get absolutely no attention. It's true. It's unfortunately true. It's just, it is what it is. When you put doctor in front of your name, people respond and they treat you different. Athletic trainers, by comparison, and this is my experience. Almost all my friends that are athletic trainers, athletical trainers. All my friends that are athletic trainers have master's degrees. I don't know any that are just bachelors, and so that's a 2-year program plus. And just like a physical therapist, athletic trainers do clinical rotations. So when I graduated with my doctorate, I had done 4 clinical rotations. And I think my friend that was doing their master's degree at the same time, she had done 3 clinical rotations by the time that she graduated. Um, so an athletic trainer and a physical therapist are both going to have clinical experience in whatever setting it is that they're trying to get into. I did home health, then I did outpatient ortho, which is just a nice way of saying if you're doing a knee replacement or shoulder replacement or general just joint pain, that's outpatient ortho. And then I did the veteran affairs, and then I did another hospital, a military hospital after that. And then, meanwhile, my athletic training friend was like local high school and then 2 local colleges. And she worked with the football team, the tennis team, and I think the soccer team at different times. So that gets you a little bit of idea of the difference in education. Now, physical therapists will definitely lord over the athletic, man, I gotta stop saying that. The athletic trainers that 1 additional year of schooling, because athletic trainers will, not all of them, but a lot of them will say, "I can do almost everything a physical therapist can do." And that's not technically wrong in terms of their ability to measure joints and strength and do special tests and assess what is likely going on, especially in the concerning of an injury. But keep in mind, that's what an athletic trainer is trained to do. They're trained to assess your joints and to look for an injury. That's what they're meant to do. A PT is meant to do the same thing, but we're also meant to do the same thing predicated on the assumption that we're getting an MRI or an X-ray or a doctor's referral from a doctor of osteopathic medicine or so on. And then with all that in mind, the patient is then presented to us and we can do our own assessment with the goal of rehabilitation. So a physical therapist and athletic trainer may be educated and schooled in the same way to assess joints. That's true. However, the physical therapist went that whole additional year learning how to do rehabilitation interventions and to learn how to look deeper at the human body besides an injury screening. I'm not saying athletic trainers only get trained on how to do screening. They can learn about neurology and all that stuff just like a physical therapist can. But a physical therapist is going to be schooled in everything about the human body. They're going to learn about the cardiopulmonary system, the neurological systems, the musculoskeletal systems, the lymphatic system. They're going to learn about aging over time and how to treat an 80-year-old patient versus a 15-year-old patient. All of this is the additional year of schooling the physical therapist goes into. An athletic trainer does not care about an 88-year-old, right? That's not their patient population. They're not going to be like, "Wow, this patient really has a hard time sitting up and standing down. That's the patient population I'm going to work with." No, they want to work with the young athletic population that is very fit and very active. And so their schooling and their training and their clinical experience is going to be more predicated on that. And just like me as a PT, if you called me onto the field and said, "Screen this guy, it looks like he just fractured his ankle or tore his ATTL in his ankle," I'm probably going to be able to do a halfway decent job at saying, "Oh, no, it's not his ATTL, it's his CF, his calcaneofibular ligament or whatever." And they'll be like, "Oh, yes, yes." And you stabilize him, you get him off, and then bada bing, bada boom, you have an MRI, and it says, "Yep, this is what he tore." I don't know if I'm going to be able to do that as fast or as efficiently as an athletic trainer, right? An athletic trainer is going to probably be like, "Oh, yep, it's this, and I'm now going to wrap this ankle and stabilize and ice it and get him off of the field as quick as possible and heading off to get his imaging done." I might be able to do it, but it's not my wheelhouse, and that AT is probably going to beat me 9 times out of 10 if you're timing me. But if you switch it around, you say, hey, this patient needs to improve within the next 8 to 12 weeks to get back to doing X, Y, or Z. Yeah, that's where I think you get into the whole realm of an AT can do it. It's probably just going to take them longer. And a physical therapist is probably going to be able to eke out the patient and get them back to what they need to do a little bit quicker. And I don't think that has anything to do with the titles, right? AT or PT. It has everything to do with the education. So, all that being said, I hope that nobody here is thinking that I'm throwing shade on ATs. I do not throw shade at ATs. They are my friends, and they are very smart, and they're very good at what they do. There are some that think they can do what I can do, and I'm doubtful that they can do it to the same degree that I can. But confidence is nine. Was it? The confidence is like 80% of the battle, and they have it. And they have it in abundance. Um, Now let's move on to where you'll find athletic trainers and PTs. Athletic trainers, like we said, they'll be on the sidelines, they'll be in the locker room, they'll be at high schools, pro teams, college teams, club teams. I've even heard of some going to industrial sites. I even see some in doctors' offices sometimes. PTs, where are they going to be? They're going to be in clinics, hospitals, rehab centers, outpatient ortho settings, home health, telehealth, and also occasionally they will be at sports games. We'll touch on that at the very end. Now, where's the confusion between the two? I kind of touched on it a little bit, but let me just really harp on it here after I take a sip of water. Refreshing. The difference between the two, kind of like we said, is how an athletic trainer does the injury screening and then helps keep athletes on the field, while a physical therapist does rehabilitation, improves active range of motion, and improves strength. So let me give you guys a quick story because it highlights this pretty well. So there's a patient, hypothetical patient that I see, and he comes into my clinic, and let's say he is a lacrosse player, and he's having low back pain on his left side, and he's having a really hard time shooting on goal and a really hard time passing because every time he twists through his spine, he has that pain. And it really limits him from being able to shoot at full power, and it also limits him from being able to turn around while he's driving, or sit in class for a prolonged period of time, and it kind of inhibits him across the board with a bunch of things. Okay, well, I'm going to do my assessment, which I did, and I go through. I'm like, okay, what's your range of motion? What's your strength? What does your hips look like? What does your low back strength look like? What does your core strength look like? What does your range of motion look like? If I didn't say that already, is there any neurological component here? No numbness, no tingling, no possible nerve impingement, no sign of spinal cord compression, yada, yada, yada. I'm going to go through that for about an hour, and then I'm going to say, okay, you and I are going to work on your hip strength, your core strength, and we're going to work on your mobility by stretching your muscles. And let's say for about a month, we work on that because let's say it's December, so it's right before lacrosse season, and he's also, let's say he's a college student. And so he's back home in town, so he's working with me, and then come January, he has to go back to school. So he worked for a month, and then he goes back to school. Back at school, he's working with his athletic trainer, and the athletic trainer is working him out, specifically giving him tailored workout programs and stretching regimens to focus on trying to improve his lumbar rotation and his strength to keep him on the field so he can keep scoring, so he can keep playing defense, so he can keep being a productive member of, let's say, the junior varsity team. And so for the next 4 months, the athletic trainer is working with him, trying to help him stay on the field and stay playable. And then he's also advising the coach, saying, hey, it's just based on the way that your star player here on the JV team, the way that his back is, I don't think it's a good idea to play him in the tournament this weekend. Maybe you can play him for one game to get here or there, but you're going to have to pick wisely which one he does, because he's going to be out of commission because he's going to be so sore for the next 2 days, right? That's the athletic training spot. Me as a PT, I'm firing on all cylinders back in small town USA, treating 40 patients a week, 50 patients a week, and I'm hearing from him occasionally, yeah, my back still hurts. Any ideas? My back still hurts. What can I do? And I might be like, hey, keep doing your home exercise program. That's probably the best you can do right now. After 4 months, school's out, he comes back and says, hey, my back still hurts. I need another eval. We do another eval. I see the same presentation. So I'm going again after his active range of motion, after his flexibility, and after his strength. And lo and behold, after 8 weeks, he's doing phenomenal. He has no pain. He's doing much better. Now, we could argue that he's doing much better because he's not playing lacrosse, but the truth is that he actually is playing lacrosse while he's seeing me. He's doing club, which is less stressful. and less demanding, but he's still playing. And I never said in this case, no, you have to stop playing because your back is so bad. I'm actually trying to work on his muscle and get him to do proper dosage. This is one of those weird niche situations where, as a PT, I'm just helping him improve his range of motion, his strength, and his mobility. And he happens to also be playing lacrosse on the side, and now he's pain free. Does that mean for the last 4 months the athletic trainer has failed him? I don't know. This is where you're going to hear the most famous PT saying ever. It depends. He could be playing 1,000 times harder at school, and I would never know. He could be playing as hard as humanly possible because he feels the pressure of JV, and the athletic trainer is working him out as hard as possible. But basically, you're just running on a treadmill. You're staying in place, and you're undoing all the stress and the damage he's doing to himself in the game, and the abuse that he's taking from other players as they're beating up on him, and you're just keeping him just barely playable. Or maybe the athletic trainer just said, you know what, I'm only going to strengthen you and stretch you because that's all you need. I'm not going to worry about anything else. That's where we get into the it depends territory, but on my personal opinion, my goal is to improve his pain, right, and to improve his range of motion and to improve his strength, and I'm doing it in a much more tailored and specific way. And that's why he's going to feel better. It's also going to help that, like we talked about the biopsychosocial, I'm recognizing that he's playing club lacrosse with me during the summer because he wants to stay active, and it's not as nearly as serious as his JV team, so he's not going to be putting in 110% effort per se. This is just to keep him in good shape. So when he goes back, he can keep playing in the next season. All those are things I'm taking into account. And does that mean that I'm better than an AT? This is where I would say no, not necessarily. The AT is doing a different job. He's keeping him on the field and trying to strengthen him. I'm using the depth of my knowledge to improve his pain, and I'm catching him in a different season in his life. If the roles were reversed and I'm doing PT while he's on the JV team, he'll probably keep beating himself up and be in more pain, but I might be able to get his perceived pain a little bit down, and I might get his range of motion better, and I might get his strength better quicker because I'm doing much more targeted interventions than just workout planning, right? That's where the it depends comes down. But if you take an athletic trainer out of their athletic training role and you put them in a clinical role next to me, well, then maybe they might start dosaging things differently because they're not worried about helping him meet goals to do on the field. They're focused on helping him get better at doing life things. And that's where I think AT versus PT really, really diverges. Athletic trainers are going to get you trying to do sports things, and a physical therapist is primarily concerned in helping you do life things. It just so happens that a lot of physical therapists are really good at helping you get better to do life things, and then as you get better doing life things, all the sports things and all the hobby things get better too. So, now, let us end on a high note. I know this is a long one, so I apologize, but let us end on the high note. Do athletic trainers and personal trainers work together? Do athletic trainers and physical therapists work together? Yes, all the time. And if the relationship between the two of them is good and full of mutual respect, then you usually have the best outcomes for your patient. And here's where it gets really wild. There are now physical therapists / athletic trainers. It's the same person who has a degree in both. And it's usually a 4-year program at least. And I know several of these personally. And this is where they're both. And this is again why that it depends comment matters so much. When a physical therapist / athletic trainer is doing their athletic training role, they are utilizing the scope of all of their education as an athletic trainer and a physical therapist in order to set their patient up for success. I can't do what they can do to the same speed or effect that they can, and I'm not interested personally in doing athletic training. I'm interested in doing physical therapy, but they have the knowledge and the brain for both, and they get to work with both physical therapists and athletic trainers all the time. And so this is where I wanted to end, because I think the direction that the healthcare system is going in a positive way, not to talk about the absolute dumpster fire inside of a train wreck, inside of a volcano, inside of a black hole that is the American healthcare medical system. But in a positive note, athletic trainers and physical therapists, in some cases, the degrees are getting pushed closer and closer together because a lot of professional teams want a person that does both. It's cost effective, and that person who's doing the athletic training and the screenings can already be programming in their mind the physical therapy rehabilitation that they need to get done. with that patient while they're even on the field wrapping up that ankle. So the future is bright for both athletic trainers and physical therapists because the relationship between the two is usually pretty darn good. The only thing that really gets between the two of them is their lobbying groups, the physical therapy lobbying group versus the athletic training lobbying group. To be fair, if you're a part of a lobbying group, whether it be physical therapists, chiropractors, athletic trainers, and this is where we get into the weeds just a little bit, all of them are going to Congress and fighting over what their individual groups should be able to bill, right? So right now there's pressure from the athletic training lobbying group that they should get access to what's called physical therapy codes that used to be just for physical therapy codes, and now athletic trainers can bill them. And long story short, what does this mean? It means physical therapy codes, which we use when we're billing for services that we provide, athletic trainers can now use. And that's a bit of an issue because that means which would you rather go to in the long run? Would you rather go to a physical therapist where, let's say, it's $130 for an eval, or would you rather go to an athletic trainer where it's $115 an hour, and you are getting marketed to you that it's basically the same evaluation? Well, you're always going to choose the cheaper one. Any human being would. And that's where, while there is competition going on from the lobbying groups to try and undercut each other, the truth is that athletic trainers versus physical therapists, at least in my experience, the relationship between the two is filled with a lot of respect and a lot of understanding that we fill different roles. It's just a little bit of a cousin rivalry where it's like you're trying to undercut me and take some of the codes and the clients that I have away from me. But the truth is we both have so many clients and so many patients that I think it's more of a rivalry right now than it is existential threat where both view each other as enemies. It's much more of a rivalry between two cousins, for example, of I'm the better soccer player, no, I'm the better soccer player, I'm the star athlete of the family, no, I'm the star athlete of the family. Versus with the personal trainers, in some cases it's straight up animosity, where a personal trainer will tell a PT they don't know what they're doing, and vice versa. Because let me be the first one to say, physical therapists, they can definitely lord over their doctorate degree and tell everybody else they don't know what's going on, and that they know exactly what's going on and they're the best. And that's definitely not always the case. You have to respect everybody's different expertises and knowledge. So, what's the takeaway? Athletic trainers are great for athletes. They're the ones that are there in the mix. They're watching for injuries, doing the screening, doing the training, helping to keep athletes on the field. And the physical therapist is the one that's waiting in their clinic to help people that have impairments. It might just so happen that the patient population for both overlaps and intersects, and a physical therapist can be seeing somebody who is also being seen by an athletic trainer who is also trying to stay on the field. But the intent for the physical therapist is not to get them back on the field and playing their best. The goal of the physical therapist is to improve their limitations. And if that happens to get them back on the field, that happens to get them back on the field. And that is a conversation for a different time regarding sports physical therapy and how that is related to athletic training, because that is much more closely related. Now, thank you so much for listening. Please consider joining the Patreon, as it helps immensely with me being able to have time to do these things. Please consider buying a shirt off of Etsy. I'm going to try and come up with tank tops soon because it is getting into the warmer weather. And please keep an eye out for the app. Hopefully at this point in time the app is out, but if it is not, it should be out soon. So thank you so much for watching. Please don't forget to drop a like. Please don't forget to rate these podcasts if you can. And everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next video. Well, podcast.